Thank you so much to our awesome presenters. What an amazing and incredibly helpful presentation for communities across Canada that continue to respond to COVID-19, particularly in terms of shelters and transition homes. We do have a couple questions that have come through so far. And so I will just read out the first question for our presenters. So we have a question from Lauren. Thank you so much, Lauren, for your question. So she is asking if the panelists could speak at all to the plan for transitioning COVID temporary hotel sites back to regular use once their leases end in March of 2022. Is this planning in process? Will clients be returned to congregate shelters, housed, or both?
It's Danielle here. I can speak to that first, but colleagues absolutely jump in. So we are working with the provincial government at the moment about a variety of different strategies. One of those strategies would be extending some of the leases on some of the hotels and motels that we were able to secure during COVID. We've also purchased some of the hotels and have converted them into supportive housing so people didn't have to leave. But certainly planning is in place, but we haven't kind of landed on any one particular strategy. But those are a couple of things that have happened to date.
Thanks, Danielle. I can perhaps just speak to the Women's Transition House programs and the hotel spaces that we have secured for that program. So as Danielle said, I mean, we are doing some planning with respect to sort of what will happen after March 31st. I think some of that is also dependent on just what happens with COVID and you know, what we see happening in terms of any changes there, and if there'll still be sort of high rates of transmission and we'll continue to need these spaces moving forward. I mean, a little bit different for the women's transition houses in that we don't have as many spaces sort of throughout the province. So we are also working with some of our service providers on ways that we can transition women into longer term housing. And some of that is looking at some rent supplements.
That's great. Thank you, Danielle. And thank you, Saras. So I do have another question that came through. Thank you, Robin, for your question. Robin is asking, she's curious about the challenges or changes, if any, that you've experienced working with community partners during the pandemic. Were there specific strategies or things that worked well for you to keep folks working together during this time and make sure that everybody was still working together in a collaborative space?
Yeah, partnerships. You know, BC Housing is a funder. We're not necessarily on the ground doing all of this. Our nonprofit partners are absolutely incredible. One of the things that we've that has really been strengthened through this is the partnership with health authorities and the real need to have them at the table as well. One of the things I think the sector it's always challenging is recruitment and retention, and certainly at this point in time, that's a real challenge. I was talking to a colleague recently where, you know, the first couple of months of COVID, we didn't know if you could even wear cloth masks. So access to PPE and all of that was a challenge, but we did end up getting something in place and procured a number of supplies. But yeah, municipal relationships, private developers, the folks owning the hotels. So yeah, and also an education piece with public health. So BC Housing and the nonprofit partners work with different parts of the health authorities, primarily whether it's subsidized assisted living or mental health and substance use, but we really hadn't worked a lot with public health. And it was this really interesting kind of education and dynamic as to, explaining for emergency shelters anyway, the congregate setting and the ability to isolate or not. So yeah, no, thank you for the question. Of Rebecca or Sorose, you'd like to comment?
Thanks, Danielle. And I think quite similar for the Women's Transition House programs as well. I mean, like I said earlier, we definitely have less spaces that we've been utilizing, but that partnership with the hotels was more so new for some of our transition house service providers and less so for some of our safe home programs that had already been operating through hotels. So we did certainly see that, that provided some opportunities for our service providers to really provide some education and information. And in some cases, some basic training as well in terms of, what women and children are experiencing when they're fleeing violence and how best to support them and what their needs are. And then I think just within the sector as a whole, we have an umbrella organization that's been really key in just ensuring that, the sector stays connected and really supporting them in terms of having regular meetings, providing those opportunities for them to be able to come together on a regular basis and share, some of those strategies and struggles and challenges that folks are having and being able to work together around that.
I'll just add, I guess, despite some of the challenges that may have been experienced in terms of accessing community support services for the providers to connect their clients to, we did still see positive outcomes in terms of women and children fleeing violence being connected to services and community support services and to housing, and likewise for the emergency shelter program, despite challenges that may have arisen in terms of partnering with people, and we did still see people move on to housing. So those were some positive we saw despite the challenges.
That is so great, Rebecca. And I think that, what you've done and what is clear throughout this presentation is that you're really using this opportunity to collect the data that you need to be able to inform, what does our response look like? Are we supporting our clients in the best way possible? And what types of outcomes are our clients going to? Where do they go once they leave a particular agency or support that we offer? So I think that is just incredible that you're really leaning into exactly what you're seeing so that you can continue pivoting and addressing homelessness in BC. I have a specific question. I was wondering, is there anything that you've changed or that you've pivoted throughout COVID throughout your COVID response that you definitely want to keep? This is something that you will put in your permanent toolbox. You will use it time and time again. Is there anything that you really learned or changed that, now you're just kind of saying, this is the way we do things now. This is part of my regular day-to-day, and this is what it will look like in a post-COVID world as well?
I can speak to the transition houses and some of their experiences. I think just moving forward, just given that COVID is likely here to stay, that we've heard from several of our service providers that just some of the ways that they're operating, some of those safety protocols that they've put in place, that they will certainly continue to operate in that way. So, just with respect to even some of the distance, some of the personal protective equipment, so again, if, somebody is symptomatic in any way, and it may not be COVID related per se, but, I think just that learning around, masks can really help with respect to some of that transition. Keeping some of that distance can really help to prevent everybody in the house from getting sick. So I think pieces like that, and I think just ways that they've adapted some of their service delivery as well is certainly something that they will continue to do. So, some have also been able to provide some support to women in remote and virtual ways. And we've certainly heard that they will continue to do that, or that being sort of the initial way that women contact the programs that they'll continue with with those methods, you know, being so women don't have to necessarily only call in, they can text, they can access, you know, a chat service or send an email. They will continue to keep those pieces in place.
Similar for some of that with the emergency shelters, just thinking about some programming that could no longer happen in person and that was happening virtually, and using technology for service delivery with, you know, nonprofits and the clients accessing their services. You know, you can actually reach, while it's not always ideal depending on what the service delivery is or the group conversation, but the ability to reach so many more people, and also, yes, the cleaning protocols. You know, it's a population who has a lot of compromised health situations as well. So, you know, pre-COVID, so it's not a bad thing to keep some of those protocols up. And what I would really like to see, and you know, we'll see what the future holds, but is really keeping those relationships with the health authorities and having them more directly involved right at the site with the clients. What we've also found is where, I mean, I think through this sector, we all face NIMBY, that people generally think that these services are necessarily, that are needed, but not near them. But where we have previously seen some resistance by municipalities, we now, with the involvement of health, they feel a lot more comfortable with having the services in their communities. So that has absolutely been a positive outcome. So I would certainly love to see if health could remain involved in if not the level they're involved now, but moving forward, still on site providing services.
And I'll just add from the data side. So before COVID, we were collecting the transition house data quite differently. We were collecting aggregated quarterly data. And when the pandemic started and we were setting up these expansion spaces where we both needed to be accountable, but like Lisa said, also need to be able to pivot based on evidence-based information. So we needed more real-time data, and we needed more information about more detailed information about stays, so at the stay level rather than aggregated data. So that was a change that we made very early on in the pandemic, and hoping that maybe that's something we can transition to moving forward as well, rather than going back to the aggregated data. So we'll be working with the sector on that a little bit as well.
Thank you so much to our awesome presenters, and thank you to those who listened in and who asked questions. I'll ask that everyone please evaluate your session. You can evaluate using the button that's located just underneath the video that you're watching now. And otherwise, we do have a keynote presentation starting at 12:30 Eastern time, so in about 10 minutes. So head over to that live stream and we'll give you a bit of a break now in between then. Thanks so much for joining, and thank you to our presenters.
Thank you.
Yes, thank you.